you doing today?
I'm good.
Ready for your shift?
Yes.
All right. So today your patient is a 72-year-old female named Annie Smith. She was admitted on the 28th of March from home with a non-healing wound on her right gluteal region. In November 2021, Annie had an abscess develop on the right hip, and this was drained in November, but it has been unhealing since then. On the 28th, she was admitted, and her symptoms were altered mental status and fever, as well as erythema and edema of the wound. Wound cultures were performed, and she came back positive for MRSA. The patient has been placed on contact precautions as well as a high-protein diet to aid in her wound healing. Doctors have prescribed Vancomycin IV antibiotics, 1 gram every 6 hours, depending on trough levels. So based on my assessment of the patient this morning, she is responding well to treatment. She is awake, alert, and oriented ×4, and her fever has been reduced. Just please provide her education on her prescription of Vancomycin this morning, and that's all my recommendation. Do you have any questions for me?
No, that is good.
All right, thank you. Have a great shift.
All right, bye. Have your name and date of birth, please.
Yes, my name is Annie Smith, and I was born on March 1st, 1950.
Okay, and then who's this young lady?
I'm Hannah. I'm Annie's caretaker.
All right, and do you have any allergies?
Not that I know of.
Okay, well, awesome. Well, I am here to teach you about your new medication that you're taking. It's called Vancomycin. Has anybody talked to you guys about Vancomycin before?
I think I heard someone mention about it. I know it's gonna help my MRSA to treat with it, but other than that, I don't really know much about it.
Okay, no worries. That's what I'm here for. I'm here to teach you. So let's start with the basics, okay? So Vancomycin is supposed to treat it's a strong antibiotic. So it's supposed to treat methicillin-resistant Staphylococcus aureus, which is also known as MRSA. And this bacteria is very resistant to any other drug, so we're using Vancomycin. You are expected to take this for up to 8 weeks, but this just depends on how well you respond to the treatment. So we will monitor her blood for the bacterial levels and we'll go from there. Okay, so now we're going to talk about some side effects, okay? So you may experience some itchiness, wheezing, low blood pressure, and dizziness. You don't have to report these unless they don't resolve, and this medication is also known to cause kidney damage. So do you know of any kidney damage or renal impairment you may have had?
No, I haven't.
Okay, perfect. We'll make sure to monitor your kidney while you're on this medication and make sure nothing happens, okay? All right, so now back to the side effects. There are some more serious effects that we do want you to report to us, okay? And this includes ringing in your ears, fevers, chills, weakness, nausea, difficulty breathing, and symptoms what we call red man syndrome. Have you ever heard of red man syndrome?
No, I haven't.
Okay, well, it causes rash, hives, redness, itchiness, agitation, fever, and swelling of the face. Also, we want you to make sure you watch out for signs of irritation on your IV. If there's any swelling, warmth, or pain in the site, please let us know. And then lastly, there is this last skin condition called Stevens-Johnson syndrome, and it causes blistered, painful skin rashes all over your body. So if you feel any rashes coming up, make sure you call your provider right away, okay?
Oh, that sounds scary. Do you think I'm gonna be okay if I take this medication?
Some side effects are serious and scary when you are taking Vancomycin, but that's why it's very, very important that you take medication as prescribed, and then call us if you experience any of the signs and symptoms that I just told you, okay? But it is very helpful in treating the MRSA that you have.
Okay.
All right, and then are you taking any medications right now?
No.
No? Okay, good. I just wanted to make sure to tell you that because Vancomycin does interact with other drugs, so make sure that you tell your doctor if you want to take an aspirin, acetaminophen, or any muscle relaxants, okay? Great. One last thing. It is very important that you continue to take this medication regimen until it is over, even when you feel better and you don't have any more symptoms, okay? This will help get rid of all the bacteria in your body.
Okay, that makes sense. Thank you.
All right, and then do you have any questions about this medication or your diagnosis at all?
We've never used a home health nurse before. Can you tell us a little bit about how that works?
Oh, okay, yes. I will be sending a social worker in to discuss with you in detail. So in the meantime, here is a pamphlet to describe everything that we just discussed, okay?
Great. Thank you.
All right, have a good day.
Thank you.
Hi there, my name's
name's Megan. I'm a social worker here at the hospital. What are your guys' names?
I'm Annie Smith.
I'm her caretaker, Hannah.
Awesome, nice to meet you both. I heard that you are being assigned a home health nurse and you guys wanted some more information about that.
Yeah, please.
Awesome, so I can help explain that process to you. Because you're being discharged with an IV antibiotic and you have that PICC line, you're going to need to be visited daily by a home health nurse so that she can administer your IV vancomycin to you. I heard that somebody already explained the PICC line process.
Yeah, they
Oh
did.
yes, they did.
Okay, great. So if you have any more questions about that, definitely ask your nurse before you leave today. I've already contacted a home health agency and we've gotten you a nurse assignment. So once you're about to be discharged, we'll hand you all the paperwork and all the information you need to know about that. But the home health nurse should be contacting you sometime today so that she's ready to start visiting you tomorrow. Do you have any questions on any of that?
No, I don't think so.
We're
Awesome. Awesome. And then if you don't hear from them today, then definitely give us a call at social work and we'll make sure that we get you in contact with them.
good. Sounds
Perfect.
good. Thank you.
All right. Have a good one.
Thank you.